Bonjour à tous et à toutes. Je suis Anne Lagacé Dowson de la Coalition canadienne de la santé, qui a pour mandat la protection et l'avancement de l'assurance santé au Canada et l'assurance médicaments universelle et publique. Nous avons rassemblé pour vous un éventail de voix puissantes et crédibles de partout au Canada, de la société civile du Québec et du Canada pour souligner l'importance de l'assurance médicaments. 2 weeks ago, Prime Minister Carney came back to his campaign promise for public prescription drug coverage, known as pharmacare, at a speech he gave in Edmonton. The Liberal Party has gone back and forth on this issue, and we're here today to underline the importance of staying the course on this issue and implementing Bill C-64. We know it's hard for the Liberal government to resist pressure from Big Pharma and big insurance, but that's what they must do in this instance. The overwhelming majority of Canadians and Quebecers want pharmacare, including Conservatives. So we have here for you a cross-section of powerful voices to explain why we need pharmacare now. We have with us today Jason MacLean, the chair of the Canadian Health Coalition and Secretary-Treasurer of NUPGI, Siobhán Vipond, Vice President of the Canadian Labour Congress, Angela Preocanin of the Canadian Federation of Nurses Unions, Olivier Surprenant of the Coalition Solidarité, Santé et l'Union des consommateurs, Frédérique Chabot of Action Canada for Sexual Rights and Health, and Manuel Arango of Heart and Stroke. So we'll start with Jason. And just before Jason speaks, just want to mention we put a big ad today in the Hill Times to catch the attention of Hill staff and elected people with regard to this issue. So, Jason.
Good morning, friends, colleagues, and fellow Canadians. My name is Jason MacLean, Secretary-Treasurer of the National Union of Public and General Employees and Chair of the Canadian Health Coalition. Thank you, Anne, and thank you for my colleagues for standing shoulder to shoulder in this moment. We're standing up for patients and all of Canadians who value public health care system. Since the Pharmacare Act was passed less than a year ago, we've seen this federal government send mixed messages on this critical program. Yes, 4 agreements have been signed, but new negotiations have stalled and no new funding has been put to the table. Mixed messages only create confusion and mistrust. Canadians deserve clarity on what is being negotiated and what it means for them. Last week, during the Liberal caucus in Edmonton, Prime Minister Carney said clearly that new agreements will be signed. Those are welcome words, but words are not enough. Canadians need action and they need funding in the upcoming federal budget. The federal government must respect the Pharmacare Act, the very law it created, and get deals with the provinces. But these deals must be consistent, and these deals must be fair. People need to know what they're getting. Universal coverage for diabetes medications, contraceptives, and birth control. And let's be clear, universal means for everyone. Single payer means public coverage that does not depend on private insurance. It means patients will have a real choice. This is why governments cannot cave to corporate pressure. Drug and insurance companies have been bad actors in this debate, putting profits ahead of people. Government cannot let their pursuit of profit undermine the promise of public health care. We also need the federal government to commit to full timelines and mandates of the Pharmacare Act, beyond simply signing agreements and remaining with the remaining provinces and territories, and that means engaging with the work of the expert panel, creating a national formulary, establishing bulk purchasing and strategy, and developing a national strategy for the appropriate use of medicines. These are essential steps towards true universal pharmacare, and we will be watching closely to ensure that every benchmark and obligation of the Act is met. The evidence is already clear. Canadians overwhelmingly believe in pharmacare. With polling commissioned by the Canadian Health Coalition, it shows that 87% support it. Across the political spectrum, Canadians understand the importance of this program. And to the provinces and territories still holding out, respect your citizens and join this program. Healthcare is not something to play politics with. No one here is satisfied with diabetes medications and contraceptives being covered, but it's an important first step towards true pharmacare. And one principle is non-negotiable. Pharmacare must remain single-payer program with no out-of-pocket costs to patients. That's what the law requires, and that's what Canadians expect. So this is about choices. Governments say that there will be large deficits in the budget, but Canadians want pharmacare funded. They don't want billions poured into military spending while urgent health care needs go unmet. The right choice is to invest in Canadians' health. Canadians deeply value our public health care system. It is part of who we are and a source of national pride. Today, advocates from across the country representing millions of Canadians stand united with one clear message: keep your promises. Don't back down. Deliver pharmacare for everyone in every province and territory. Thank you very much.
Thank you, Jason. My name is Siobhán Vipond, and I'm the Executive Vice President at the Canadian Labour Congress. And just last fall, we were all standing here celebrating the passing of the Pharmacare Act. And it was a victory made possible with the coalition or the agreement between the NDP and the Liberals after decades of advocacy and working hard. And as you've heard, this is the first step of what we want to see as we're moving forward. And it's something that the labor movement, workers and unions have been pushing for many decades now. So we're not at the finish line. And failing to make these deals is putting us even farther behind. Nation building is more than the physical infrastructure. It's about the social infrastructure. It's about social programs and public services that define us as Canadians. And programs like Medicare, like pharmacare, that we have been championing, that's what makes our country strong. That's what makes us sovereign. And so right now, we're getting mixed messages. There's a commitment from Carney to sign these bilateral agreements, but then we're hearing not now, not yet. And this is a real concern and, quite honestly, a disappointment. And I want to be, very clear that provinces don't know what they're agreeing to, and workers and their families don't know what's going to be covered. So we need to stop this confusion. Ottawa needs to make a commitment and deliver on this promise and respect the Pharmacare Act. And that's really what's at the heart of it, because workers shouldn't be dependent on their insurance coming through their private insurance through their workplaces to get the medications that they medically need. And because we've seen how these medical insurance giants operate. They put profit ahead of care for way too long. And this is really a fight of fairness. And it's about the future of our economy. Since 2022, unemployment has jumped nearly 2%, from 5.3% to 7.1%. Let's remember what those numbers mean. That's 450,000 additional people out of work. And let me repeat that. That's 450,000 people out of work who their families may no longer not only just lose their job, but lose their benefits attached to that job. And so that means they don't have the same access to their medical coverage of pharmacare. And so that's why we need universal public pharmacare system. It's going to be the only answer. No one should lose their coverage just because of their job, and coverage for contraception and birth control must be guaranteed. So provinces want deals. Those deals have to be fair, they have to be consistent, and they have to be found in equity. And so we have enough evidence to prove that pharmacare will keep Canadians healthier, right? This is about reducing ER visits. It's to save families from choosing between groceries, rent, and their prescriptions. And so our message to the federal government is very simple. Stop the mixed signals, respect the Pharmacare Act, deliver fair and consistent agreements. The expert committee will report on in the minister's hands October 10th, and it must be made public November 21st. Let this be the last report. No more delays. We want pharmacare, and Canadians need it now. I will pass over to Angela.
Thank you, Siobhán. Good morning, everyone. My name is Angela Preocanin. I'm the Secretary-Treasurer of the Canadian Federation of Nurses Unions. We represent 250,000 nurses and nursing students across Canada. For 3 decades, nurses have called for a national pharmacare. We see the damage done when patients can't afford their medications, missed doses, preventable hospital visits, and impossible choices between medicine, food, and heat. The Canadian Pharmacare Act was a step forward, but legislation does not fill prescriptions. To make pharmacare real, every province and territory needs to partner in the federal government, just like the rest of our healthcare services. Right now, provinces are getting mixed messages. A few weeks ago, the government was non-committal. Now deals are back on the table, but uncertainty undermines trust. The federal government must be clear and consistent. The Pharmacare Act must be respected. Universal means for everyone. Single payer means public coverage that doesn't depend on private insurance. Anything else isn't Pharmacare. Meanwhile, the insurers are working to block progress. In New Brunswick, the health minister revealed that insurance companies are threatening to drop coverage for key diabetes drugs if Ottawa proceeds with the deal. That's corporate strong-arming profits over patients, and the federal government cannot allow it. Pharmacare is good for patients and good for the economy. It will save provinces billions in preventing hospitalizations and finally delivers on the promise of Medicare. Canadians are ready, nurses are ready, and the federal government must be ready too. The pressure is on Prime Minister Carney and Minister Michel. Deliver fair, transparent, universal pharmacare agreements. No more mixed messages, no more excuses. Respect the Pharmacare Act and make pharmacare real for everyone in this country. Thank you. Olivier.
Bonjour, je me présente, Olivier Surprenant, analyste en politique publique à Union des consommateurs. Union des consommateurs est membre de la coalition Solidarité santé, un regroupement de plus de 40 organisations citoyennes, communautaires et syndicales du Québec qui défend la gratuité, l'accessibilité, l'universalité et l'intégralité du système de santé depuis près de 35 ans. Ensemble, nous représentons plus d'1 million de Québécoises et de Québécois. Comme nos collègues d'un océan à l'autre, nous demandons au gouvernement fédéral de tenir sa promesse de financer l'élargissement de la couverture d'assurance médicaments dans toutes les provinces et de coordonner les efforts vers une couverture publique et universelle, sans que personne ne soit laissé pour compte. Contrairement aux idées reçues, le Québec n'est pas le modèle à suivre lorsqu'il est question de régime d'assurance médicaments. Sa couverture universelle s'avère de plus en plus coûteuse, inaccessible et inéquitable pour la population. En effet, les disparités sont nombreuses entre les personnes qui ont accès à des régimes privés et ceux qui sont couverts par le régime public, à commencer par le prix des médicaments. Également, on assiste à un phénomène où les honoraires pharmaceutiques pour les assurés au privé peuvent varier grandement. Même entre sur la même rue, deux pharmacies différentes, le prix peut varier énormément. Aussi, de plus en plus d'employeurs, particulièrement dans le milieu communautaire, se retrouvent forcés d'arrêter d'offrir des assurances collectives, étant donné que l'assurance médicaments coûte de plus en plus cher et qu'au Québec, on est obligé d'offrir une assurance médicaments si l'on souhaite offrir des assurances collectives à ses employés. Ainsi, les gens renoncent ou perdent plusieurs de leurs protections sociales en emploi. Par ailleurs, face aux politiques tarifaires de l'administration Trump aux États-Unis, nous sommes confrontés à une menace directe quant à nos capacités d'approvisionnement pharmaceutique, ce qui risque de se répercuter directement sur les consommateurs par une augmentation du prix de leurs médicaments. Il est donc urgent de franchir une nouvelle étape. Ottawa doit s'engager dans des négociations avec Québec et Québec doit accepter de collaborer avec Ottawa pour obtenir l'argent dont il a grandement besoin pour augmenter le filet social en matière d'assurance médicaments. Le Québec, soit dit en passant, on le rappelle au gouvernement provincial, le Québec collabore déjà avec le reste du Canada, notamment à travers les travaux de l'Alliance pharmaceutique pan-canadienne, et il serait bien illusoire de croire que dans un contexte politique et commercial aussi tumultueux, le Québec, qui représente moins d'1% du marché mondial des transactions pharmaceutiques, puisse tirer seul son épingle du jeu en matière de production, d'approvisionnement, de recherche et de développement, d'évaluation pharmaco-économique et de négociation. À nos deux ordres de gouvernement, donc, la population québécoise souhaite que l'on aille au-delà des promesses et qu'on passe aux actions concrètes. Refuser d'agir, ce serait de condamner des milliers de personnes à choisir entre les médicaments dont ils ont besoin et payer leurs factures qui augmentent de plus en plus dans tous les domaines. Les médicaments ne sont pas un bien de consommation comme les autres. Leur accès ne doit pas dépendre des règles du marché. Au Canada, on a fait un choix de société, au Québec aussi, qui nous distingue des États-Unis. La santé est un droit et nos gouvernements doivent le protéger. Nous demeurons donc présents pour nous assurer qu'à Québec comme à Ottawa, on agit sans conséquence. Merci.
Good morning. I'm Frédérique Chabot. I'm here on behalf of Action Canada for Sexual Health and Rights, Canada's Planned Parenthood Federation. We are experts in sexual and reproductive health and policy, but more importantly, we are here speaking on behalf of the public. Canadians want and deserve universal access to prescription medicines. And our government promised this that no one in Canada would have to choose between feeding their kids and buying the medication they need to stay healthy. Yet too many people still face that exact choice every day. Picture a parent at the kitchen table. Rent is due, grocery bills keep climbing, their child needs new shoes, and then comes a decision. Fill the birth control prescription or the asthma inhaler. There isn't enough for both. These impossible choices are not hypothetical, and they are not accidents. They are the direct result of policy decisions that leave people at the mercy of insurance companies and big pharma instead of delivering the healthcare Canadians expect. The solution is simple. Make prescription medicines part of our universal healthcare system. That's what pharmacare means. No patchwork, no gaps, no one left behind. Contraception is central to this. Contraception is not a luxury, it's a lifeline. It allows people, especially women and those who can get pregnant, to decide if, when, and with whom to have children. It allows them to finish their studies, pursue careers, and build the lives they want. And the evidence is clear. Every dollar invested in contraception saves government at least $3 in health and social spending. Countries that provide free contraception see more women in the workforce, fewer unplanned pregnancies, and stronger outcomes for children and families. The UN calls contraception one of the greatest public health achievements in the last century. Simply put, contraception is one of the most powerful tools we have for healthy communities, gender equality, and economic security. Canada must make contraception free and accessible to all, no matter the province they live in or what's in their bank account. We've already seen it in British Columbia, where free access to contraception immediately expanded the use of more effective options. Last year, a law was passed promising that across Canada, people would no longer have to choose their birth control based on what they could afford, but on what was most effective and what worked best for them. Canada cannot settle for a patchwork solution when a system that works for everyone is within reach. What we need now is courage. Courage to invest in the health of Canadians for the long term. Courage to resist pressures from powerful interests who want to block this historic step forward. Because caving now and walking back from single-payer, universal pharmacare will cost all of us more in the long run. This is Canada's chance to show that when times are tough, we don't settle for less. We invest in each other. Pharmacare is not just health policy. It is affordability policy. It is economic policy. It is leadership on gender equality and human rights. The government promised this. Canadians want it and need it, and the evidence supports it. Pharmacare is healthcare, contraception is healthcare, and now is the time to finish the job and deliver.
Thank you very much. My name is Manuel Arango. I'm the Vice President of Policy and Advocacy at Heart and Stroke. First, I would like to congratulate MPs and Senators for passing historic pharmacare legislation last October. This legislation lays the groundwork for equal access to life-saving drugs and is a step toward improving drug affordability, drug coverage, and providing healthcare cost savings. It's also very positive that we have 4 bilateral agreements that have been signed to date. Providing universal access to diabetes drugs and contraceptives is a great first step towards national pharmacare. It's also very helpful for people living with heart disease and stroke because having diabetes increases the risk for these conditions. Also, women with diabetes have an even greater risk for heart disease. As well, people with diabetes are more likely to develop heart disease and at a younger age and 3 times more likely to die of it. Finally, I would like to thank the Prime Minister for his recent comments in Edmonton, where he reiterated his government's commitment to finalizing the outstanding pharmacare bilateral agreements. Make no mistake, this is a critical and highly important commitment to the health of people in Canada, and we need to see this commitment followed through on. Why? Because Canada is the only country with Medicare that does not include essential prescription drugs as part of its universal healthcare program. Therefore, there are people that have, as a result of this, affordability issues with respect to drugs. And in fact, we know that 7.5 million people in Canada either do not have any prescription drug insurance or do not have sufficient drug coverage. At a time when food insecurity and the rising cost of living are daily concerns for many Canadians, countless individuals are forced to make difficult trade-offs to afford essential prescription drugs, such as cutting back groceries, taking on debt, delaying rent, mortgage payments, or utility bills. They may also have to skip doses, split pills, or not fill or renew prescriptions due to cost. For these reasons, it's critical that the federal government move immediately to finalize the outstanding bilateral agreements with provincial and territorial governments. We know pharmacare works. We have evidence from other countries. The government's own expert advisory committee spoke to this in the 2019 Hoskins report. Of course, evaluation of our programs is important, but let me be clear, that can be done once it's fully implemented across the country. We don't have time, nor is there a need to do it before that. Looking to the future, after all bilaterals have been signed, Heart and Stroke recommends that the federal government expand the national formulary to cover prescription drug medications for heart disease and stroke. In the meantime, Heart and Stroke urges the federal government to move quickly to finalize the outstanding pharmacare bilateral agreements. It's a matter of equity. All people in Canada deserve the same access to life-saving drugs. Thank you.
Okay. So that brings our presentations to a close. So if there are any questions?
Hi, Bryce Patel. I mean, a couple of you have brought up today, the mixed messages around pharmacare and healthcare, a lack of a clear position on expanding pharmacare. So do you, I guess this could go to any one of you, do you believe that healthcare is a priority for the current government?
I believe it wasn't a priority prior to the election, but it's through the actions of Canadians standing up and bringing issues forward that it actually landed on the radar, even for the leaders' debate and everything else. Then we were sidetracked with the elbows up and everything that's going on with tariffs and stuff like that. So that has put things to the wayside where we were starting to hear mixed messages, but this is a promise that was made from the majority of the Liberal MPs that are there right now, and what we need is for them to hold on to their promise and deliver this for Canadians. People are skipping meals because of their prescriptions, and we need to be able to move forward on this.
Thank you for the question. I think one important piece to clarify is that what we are hearing is a backtracking from a single-payer system towards a fill-the-gap approach, and this is what we are very concerned about, because if health is a priority, of course it is balanced with building a strong economy and investing in a declining productivity across the country and making sure that industry has the space to do its work to bring back an economy that will mean more investment in social programs later. But to accept to go fill the gap means killing a model that is actually a long-term investment and will leave a lot of people behind. So people between jobs, people who have trouble accessing insurance because their partner controls the insurance, young people who need autonomy and privacy to access their medication. And so when we are hearing that they want to balance out a strong economy with this historic investment in healthcare infrastructure, we are seeing that, in fact, this will cost us a lot of money. It will reduce our ability as a country to negotiate prices. It will reduce access to medication, which will impact the weight on healthcare systems across the country. And it will mean that the promise and the advocacy that went into a historic change in adding pharmacare to Medicare will now be moot. So this is a big concern. So even if it's a priority, it is balanced with an approach that actually would not be a long-term investment, would not bring the return on investment that this country deserves.
Ask a quick follow-up to that point. I know that we've heard that possibility raised of a fill-the-gaps approach from, for instance, the CPHR report that came out last week. Are you guys hearing that from the government level?
Yes, some conversations with government officials lead us to believe that this is something that they're seriously considering as a way to fulfill their promise about continuing to strike deals with provinces. We are also seeing increasingly the balloons appear in media in terms of the government being called to fill the gap instead because the landscape has changed and we must now make difficult decisions. But the fact is, a fill the gap approach is not a good investment for Canadians, and it's not a solution that will actually improve health outcomes in the way that a real universal single payer pharmacare will do.
I also just want to make it very clear about the mixed messages. It has been around pharmacare, as you have heard, but there's also been mixed messages about investment. Because on one hand, we're hearing, whether it's the tariffs, whether it's the crisis of the economy and what people are working and, and what this means to be Canadian, that we need to do investments. And then on the other hand, all that's being floated about the upcoming budget is how we have to go into austerity measures. And every time you go into those measures, what you're doing is shorting Canadians of what they need. These are jobs, these are systems. This is what we need because we need to insulate ourselves from anything that comes forward. This is about risk reduction and investing in Canadians. So our concern around mixed messages is absolutely about pharmacare, but it's absolutely about when we're hearing about investing Canadians. I have concerns about which Canadians they mean, because this should be about universal systems that support all Canadians so that we can weather the storm that we all know is ahead of us.
I'm just going to jump in and say, with regard to the C.D. Howe report, what was in that report is not new. That's the same discourse we've been hearing literally for decades, just repackaged. Insurance and pharma don't like this idea. They have dozens, if not hundreds, of lobbyists in provincial legislatures and here on the Hill pushing against this, despite the fact that the majority of Canadians want it and need it, as was said earlier. So this is a classic struggle between profit and the well-being of the population. Puis c'est depuis des années, depuis des décennies que c'est comme ça, que l'industrie essaie de bloquer, comme l'industrie a essayé de bloquer l'assurance maladie en soi. This is public interest versus corporate interest. It's a real test for the Liberals, because they've gone back and forth on this, and most lately they've come back to it. So we really hope that they hew to this, and that's why we're here today. That's why we put this ad in the paper, and that's why we're going to continue to push on this. This is extremely important, and it is the best way to protect and advance public health care for all Canadians, is to provide access to medication. And I just mentioned that in England and other healthcare countries, this is a no-brainer. This has already been in place for decades. It's really here in Canada where the lobbies have been so effective that we have to be here to push back, and we will continue to do so.
We have time for one last question.
Maybe I can ask something a little bit off topic, if anybody wants to take this. Obviously, lots of concerns being raised today about healthcare disinformation, given the announcement that came from the White House and from RFK Jr. We're expecting to hear him say that he has found a definitive link between use of Tylenol in pregnancy and autism. And so I'm curious what you folks who work in this space would like to see Canada's federal government do, PHAC do, in the face of all this misinformation.
I'll just say, and we say this on a lot of issues around Medicare, the decisions about our health and what we need for medical care should be with health professionals. And so when we invest in our systems, when we invest in public health care, when we invest in pharmacare, that means my conversation about my medication is with my health provider and my pharmacist. And that's who should be making the decisions with me. But that means we get the correct information, because these aren't talking points to try and concern people. And, we have strong systems that make sure drugs are safe. We have strong systems that make sure that our, medical personnel are trained. And so we honestly need to keep putting into our public systems, because those are the right people to consult with us as individuals on what our health journey looks like, not a tweet that is going to try and scare us into something that is honestly ridiculous. Yeah.
And to speak to that, this is an excellent question and certainly a real concern for Action Canada. So we are seeing social media platforms and tech companies curb access to information by bending the knee to the Trump administration. We know that Meta has included new policies on what is the kind of conversations around gender and sexuality, sexual health that is sanctioned. And we've had to have conversations with Meta when we're seeing Public Health Agency of Canada campaigns on syphilis, on endometriosis, and other sexual health issues be completely blocked in Canada, as are sexual health clinics and their messaging for the populations they serve here. And so this is a risk that has been identified by the Government of Canada largely, AI, disinformation, and at large access to information is one of the top risks this country faces, including when it comes to democracy and democratic institutions. The Canadian Association of Doctors, now I'm...
Canadian Doctors for Medicare?
No.
Canadian Medical Association.
Yes, the Canadian Medical Association and the SOGC, so the Society of Obstetrician Gynecologists of Canada, have both identified disinformation as one of the top threat to health outcomes in Canada. So this is something that we need our government to look at closely. We have recommendations for them in terms of regulations for tech companies, for social media platforms, for access to information, and they need to invest in a strong healthcare system with community clinics, with family doctors for everyone, with enough resources for people to have these conversations, to have the sexuality education or health information and education that they need to make choices that are based in real evidence. Thank you for that question.
And science, yeah.
Thank you. That's all the time we had for this press conference. Merci. C'est ce qui conclut cette conférence de presse.
Merci au personnel de la tribune de presse. Thank you. Thank you, press colleagues.